Okay, after that small bit of furniture rearrangement, welcome into this morning's panel, Culture, Health and Wellbeing. I have two small messages for you. One is on the tables. You'll all have seen these. You're waving at them yet, but when the session closes at 12:30, we'll ask you to put on your coat and follow the instructions, because we're going to take a group delegate photograph outside in the courtyard, holding up Culture Future Goals. So that's the first bit, so bring it with you and put on your coat because it's a bit chilly out there. And the second is we have been throughout the summit playing some very short videos which are about the various elements of the cultural programme of Dublin City Council and the Culture Company. And we think that they explain much more the impact of the work that we do, rather than us standing here talking about it endlessly. So enjoy, and then welcome to Lars and the panellists for one I've been waiting for.
What matters about this sort of work is it really shows that everybody matters, that all of us have a story, all of us bring our own narrative, we carry it with us all of the time. And the space and the platform of how Culture Company works enables people to really comfortably express their narrative, or not even express it, but begin to make sense of it.
All the programmes and workshops that the Culture Company run, they're just amazing, and they're so different. I was missing out on so much while I was working, and I could be here dancing or singing or reading, and it's so essential, absolutely, for our health and well-being.
There's a huge appetite for the arts in this city, and an appetite from people who don't just want to consume it, they want to interrogate it, they have opinions about it.
Because of the way we're working together, we're getting to know each other and exploring the narrative together, and so there's this incredible understanding of each other's lives.
I mean, what matters about this type of work is because it's human. I mean, what's the point of the arts if they're not enriching our lives, challenging our lives, celebrating our lives? One of the mistakes of making art in a capitalist culture is that you think it's the reserve of the elite in some way. It's not. Everybody gets to make art.
By taking part, a lot of things surprised me. Like, there were so many people involved from different walks of life and from different areas, and we were all together in one place. It has given me great confidence, and it gives such a balance to our lives.
Fantastic. That was a really, really nice opening for this panel, and I'm so glad that we've got the right person here to speak about that fantastic project with us a little bit later as well. Welcome to the Culture, Health and Wellbeing session. My name is Lars. I'm Secretary General of Culture Action Europe, the major network of cultural networks, organizations, practitioners, that means researchers, cultural workers, artists, policymakers, in the cultural sectors in Europe. We are, as a network, we have the main goal to advocate for better conditions for the cultural field in Europe. We are concerned with policy, and we find it really important to talk across all disciplinary areas and also outside of our cultural disciplines. So health and well-being is one of our major partner areas we engage in with. I guess that, as we have seen in this video, health and well-being is in the focus of the cultural sector at the moment, and really largely in the public discussion. Certainly accelerated by the experience we've gained during the pandemic with loneliness that is experienced broadly, with mental health issues that are on the forefront of our concern at the moment, quite rightly. But there has already been a lot of evidence before the pandemic. I'm glad that we will dive a little bit deeper with the opening keynote of this panel into the WHO report from 2019, and also with Niels Fietje, who will speak a little bit later, a report that has collected over 3,000 pieces of scientific evidence how culture contributes to health and well-being. Now, within Culture Action Europe, we've been running a major project which was really a focus point of our work in the last years, the Culture for Health project. And I'm also really happy that there are a lot of people on the stage that have contributed in one way or another. Also as partners, Stefan, it's great that you are here as well, where we have looked at what has happened since 2019 and collected more than 800 projects in a database that is searchable. I invite you to go there. Either you go to the Culture Action Europe website and find your way, or you go directly to the Culture for Health website that provides a lot of resources for you to look at. We've brought the summary of the report, which is, this is a friendly summary, thin and accessible. The report itself is really thick, and we didn't want to schlep it in our suitcases, but it's as a download on our website, and I encourage you to go there and look at that as well. But we've not only collected the evidence and policy recommendations and identified challenges we need to talk about, but we've also compiled a compendium for practitioners that want to set up collaborations between the cultural sector and health and well-being organizations that show a little bit the do's and don'ts, the challenges that are ahead if you engage with one another. And I think there is certainly, that is something we can elaborate in the conversation maybe later, a big challenge for us to tune in our languages, our expectations, to really see how the two sectors, health and well-being and culture, probably also arts education, higher arts education, artistic research and scientific research, how they can tune in a little bit better in their agendas to further the impact that the collaboration between culture, health and well-being can have on our societies. Before we dive into the content of the panel, I would like to invite Jose Alvarez, the policy officer of the UCLG World Secretariat, to give us a little short introduction, if you will, please.
Thank you, Lars. Thank you to my colleagues at the Committee of Culture of UCLG, and obviously to Dublin for hosting us in this summit. And I wanted to start by saying that health for local and regional governments is and has always been kind of a complex subject. Local and regional governments all over the world don't have the necessary tools and the necessary budgets often to provide access to health for their populations when there is a national framework that is adverse, and more often than not, their role when it comes to health lies in ensuring the social determinants of health. It lies in acting for reducing air pollution, maintaining the water supply, ensuring healthier food systems, etc. So the work of UCLG in this regard has been twofold. UCLG has been collaborating with the universal health coverage movement for the past few years in a collaboration that has deepened with the pandemic to advocate for health for all, for stronger primary care. UCLG has also been engaged as in promoting and reporting on the activities that local and regional governments have been doing to ensure health and to ensure equal access to health within their communities. In the previous session, we spoke about the report that UCLG facilitates on behalf of the Global Task Force of Local and Regional Governments every year to the high-level political forum, discussing the actions that local governments are doing to localize the 2030 agenda. And in 2021, one of the key focuses was on localizing SDG 3. And in it, we began to see what initiatives in particular they were doing. To our surprise, or not such a surprise considering this panel, many of the key initiatives that local governments were doing to ensure health in their cities when they do not have the competences to ensure access to healthcare in itself were in ensuring that their communities had access to initiatives that could improve their physical as well as their mental health. And in it, some of those initiatives were related to what we will be discussing in this panel, to the relationship to the arts, to relationship to accessing open and public spaces. So So what we wanted to do was with this session, was to bridge two areas that have often been seen as isolate. You know, what is the relationship between the arts and access to health? And the work of Dublin, which was awarded the Culture Award with the AWE initiative, as well as a report from Culture Action Europe that Lars has just been introducing, shows that providing access to museums, providing access to cultural activities helps strengthen the sense of ownership of citizens in their communities and helps strengthen communities' mental health. And this has been even more of a priority during the last 2-3 years, in which people have been in lockdown, in which we have truly seen the toll that not having access to your day-to-day cultural activities can have with you. We will also see in this session the work of Dr. Daisy van Coort, whose investigation that was also introduced by Lars provides the framework to understand just how culture can strengthen the health of communities. Culture can strengthen, in particular, mental health. How it can strengthen, let's say, people's well-being and the well-being of everyone in cities, regardless of access to healthcare in itself. And these local actions also need to strengthen our advocacy at the global level. I introduced first that local governments are advocating to have a stronger say in global frameworks regarding healthcare. And these initiatives that we will start to see in the session will need to help us strengthen our case, and I'll finish now. Strengthen our case in the international agendas, help strengthen our case towards national governments to bring together local cultural initiatives and the local health agenda. Thank you, Lars, and apologies if I went over time.
No. Thanks very much to you, Jose. I think this frame is really important for us to realize, and it's not you being over time, but it's just us all having started too late, and our keynote speaker being online at the moment and having to move forward fast. So still, thanks very much for that frame. I think that perspective of recognition, political recognition, but also awareness about the possibilities is something we have to develop a little bit further in the conversation. And with that, I move quickly into our first contribution by Daisy van Coort, a British researcher who is an associate professor of psychobiology and epidemiology at University College London. Her research focuses on the effects of social factors on health, including loneliness, social isolation, community assets, arts and cultural engagement, and social prescribing. In 2022, I want to add, she won the international award UCLG Mexico City Culture 21 for this work. And Daisy, I'm really excited that you are with us online, that you took the time. I mentioned the WHO study, which was a groundbreaking report and the basis also for the Culture for Health project that I've mentioned. I'm so glad that you're with us, and the floor is yours.
Thank you so much, and it is such a pleasure to be speaking at your event today. I'm going to be talking to you about the impact that arts and cultural engagement can have at a population level. So I'm sure that many of you are familiar with the report that we published with the World Health Organization on the impact of arts on health, looking both at the prevention and promotion of health, as well as the management and treatment of a wide range of mental and physical health conditions. Now, this report included very diverse types of studies. As you heard, there were over 3,500 studies in the report, and these included things from randomized control trials to surveys and ethnographic studies, case studies, laboratory experiments, and various evaluations. But there is a challenge with many of these types of studies, that they can often have smaller sample sizes, they can look at shorter term engagements, they can look often at specific types of arts programs designed with health in mind, rather than the daily creativity that many of us just engage with for the pleasure of it. And also, we have to be questioning always whether the people who agree to take part in research studies on arts and health are representative of the whole population. But this is where a particular type of study called cohort studies comes into play as being an important type of study to tell us about population level effects. And when we're thinking about the role that we need to play in policy and in practice in strengthening the relationship between arts and healthcare, it's important to think about this population level. So cohort studies track thousands of people over often their entire lives, gathering vast quantities of data on every aspect of their health, their behaviours, their economics, even their biology. And in fact, many of these cohort studies contain questions on arts engagements. And my team specialises in analysing these very large data sets to look at the population level benefits. Now, naturally, if we're observing people rather than experimenting on them, there are actually many other things that could explain why we might see a relationship between arts and health. And this could include demographics or socioeconomic factors. Wealthier people might just be healthier and engage in the arts more. There can also be physical or behavioural reasons why people do or don't engage in the arts and have different health outcomes. And these can also be geographical and even passed down over generations. But when we're doing this large-scale work, what we're particularly trying to identify is where the relationship between arts and population health exists, even when you've taken all of these factors into account. So my team and I build vast, complex statistical models that map all of these different factors. I want to talk you through some of the exciting findings that we have showing that arts engagement does affect health at a population level and is therefore actually an important, underrated health behaviour and factor that we could be changing to support public health outcomes. All of these analyses have been adjusted for all of those confounding factors that I mentioned, so they show that independent relationship between arts and health. One of the things we hear about a lot is that the arts can affect our well-being. And we not only see this at an individual level, as you just saw in that wonderful video, but also at a population level. In this analysis of 23,500 people across 4 years, we found that people who engaged more participating in the arts, shown in blue, or engaging in culture like going to museums or concerts or galleries, shown in orange, both had lower levels of mental distress, higher levels of mental functioning, and higher levels of life satisfaction 4 years later. And like I mentioned, this was adjusted for all of these confounders that could explain that relationship. So we're seeing this public health impact on well-being very clearly coming through now from lots of different cohort studies. I'm showing you example results, but we've now published over 100 scientific papers using these cohorts in relation to arts engagement. And I'll point you at the end to where you can find out more about other studies. We're also crucially seeing that arts engagement can help to prevent the onset of mental illness, again, at a population level. In this analysis, we tracked over 2,000 adults over the age of 50 in England who had never been diagnosed with depression and did not currently have it. And we followed them up across 10 years. We found that the more often they were culturally engaged, going to the theatre, music, opera, galleries, cinema, or other cultural events, the lower the rate of developing depression over the next 10 years. So for people who were engaged once a month or more, they had nearly half the odds of developing depression compared to those who never engaged. We also see benefits for cognition, looking at memory and semantic fluency, which is a measure of executive function in older adults. We tracked 3,500 adults over the age of 50 every 2 years for 10 years, and we looked at their memory across that time span. As you can see, the more often that people went to galleries, museums, theatres or concerts or live music events, the better their memory was and their executive function a decade later. Interestingly, we don't see this as clearly for cinema, but cinema is a screen-based activity, so it could arguably be seen as the ultra-processed food equivalent of arts engagements. We've also been able to look.
On a également observé
Similar methods we tracked in 2 different studies, 10,000 adults and nearly 4,000 adults over the age of 50. In the graph on the left, you can see that the more people engaged in arts, the lower their odds of developing dementia over the following 10 years. And we see this in the rate of developing dementia as well. So people who are more engaged in culture develop dementia later, and they've got a slower progression towards that dementia diagnosis compared to people who don't engage. And these effects are very similar, as you can see, to socializing. Socializing is well respected as a health risk behavior. People who are lonely or isolated, we know that is bad for their health. But as you can see, that socializing graph and cultural engagement graph are almost identical. We're seeing very similar effect sizes for arts and culture as for better known health exposures. Similarly, for physical health, looking at 3,500 adults over the age of 50, we looked at people who did not currently have chronic pain, and we tried to ascertain if they would develop chronic pain over the following 12 years. Now, chronic pain often combines both physical factors and psychological ones like depression, which can be associated with the outcome. And we know chronic pain is extremely difficult to treat with medication. What we actually see here is that vigorous physical activity once a week has a 26% reduced odds for developing chronic pain over the next 12 years. Now, that is well recognised as a risk-reducing factor. But what is less recognised is engaging in cultural activities once a month, which, as you will see, has almost identical effect size in terms of reducing that risk of developing chronic pain. As you'll see, a message of what I'm saying is the need to take arts and culture as seriously as other health risks. And you can see that again in this graph. We looked at age-related disability. So this is, as people get older, if they have difficulty doing the typical activities that we need to do in daily life, like being able to eat or bathe, get dressed on our own, and also grocery shopping. These are known as activities of daily living. And what we can see from this graph is that the more people were engaged in cultural activities, the lower the risk that they developed a disability over the following 12 years compared to people who never engaged. And again, you can see very similar effect sizes for moderate exercise to cultural engagement. The bars that you're seeing and the numbers are slightly different because the bars show the incidence rate, whereas the numbers shown in red with percentages have been adjusted for all of those different confounders that I mentioned earlier. In fact, we've even done analyses showing that people who engage in arts and culture have a lower mortality risk over the following 14 years. This was first proposed in a paper in the 1990s in the British Medical Journal from a team in Scandinavia, but we repeated analyses using a larger, longer cohort study a few years ago and republished ours in the British Medical Journal too. And as you can see here, people who are more engaged in arts and cultural activities, who are shown with the top dotted line, had a higher survival rate than those who were never engaged, shown in the hard black line that goes down the most steeply on the graph. We did look very carefully at what explained these results, and about 40% of the association is explained by various things that you can see in the table. So, for example, wealth explains about 9% of this association. Your cognition, like your cognitive impairment, if you are cognitively impaired, you're less likely to engage in the arts, and it is a risk factor for dying. That explained about 15% of the engagement. But we were finding that the other 60% was not explained. So this, again, suggests that there are these independent associations between arts engagement and health outcomes. I've been talking at a population level, but I want to zoom out even more and talk at multiple population or even global levels. We recently published a paper in Nature Medicine where we looked at engagement with hobbies, which included creative arts activities alongside other things. We found that the levels of hobbies vary dramatically across different countries around the world, from around 1 in 2 people engaging up to 96% of people engaging. And what we looked at was whether there were associations at this global level between arts and hobby engagements and health outcomes. So we analysed the results for 16 different countries and then meta-analysed our own findings. What you can see on this graph is that when we pooled all the results together, these little green diamonds show that there were overall health effects for lower depressive symptoms, better self-reported health, higher happiness, and higher life satisfaction over 8 years of follow-up. And again, at a global level, we actually see that countries that have higher levels of hobby engagement have higher happiness levels as a country, and they also have higher levels of life expectancy. Similarly, countries that actually make the time for hobby engagements, they have more leisure time available, have higher levels of life satisfaction. I just want to touch very briefly on why these effects happen. one of the reasons is that arts activities combine lots of different ingredients which help to explain how they achieve health benefits. These can relate to the project people engage with, who they engage with, and the context that their engagement takes part in. And we find that some of these ingredients are common to very well-known health behaviours. For example, arts engagement can get people out of the house, thereby providing gentle physical activity and reducing sedentary behaviours. It provides social interaction often that can reduce loneliness. And also it can combine lots of the different ingredients that we see in cognitive behavioural therapies for supporting mental health. Things like learning to regulate your own emotions better. But there are also some things that are unique to the arts, like the aesthetic engagement, the imagination that's involved, the creativity, and the high levels of sensory stimulation that we get from engagement in the arts. And these are unique ingredients that only the arts provide us with. These ingredients trigger different causal mechanisms, which can be psychological, biological, social, and behavioural. And it's these different mechanisms that then link our engagement with arts through to health outcomes. So this can be psychological mechanisms, for example, the arts helping us to build a sense of self and identity and to build coping and resilience. Biologically, we see changes in our brains, in biomarkers across hormones, immune systems. We see changes in our cardiometabolic system and our physical performance. Socially, we see changes in social bonding and the building of social resources like social capital. And behaviourally, arts engagement can increase our motivation, our behavioural drive, and our ability to engage in other health-promoting behaviours. Crucially, we see these not just at individual levels, these mechanisms, but also at group levels. For example, arts engagement through lots of different arts activities and communities can build social cohesion at a group level. The huge challenge that we have, though, is not all people can access the arts equally. We've published a lot of research showing how uneven this distribution is across demographics, socioeconomic factors, and geography, as well as across health conditions. Often the people who could benefit most from the arts engage the least. But in the past, there's been a rhetoric suggesting it's up to the individuals to change their behaviour, that perhaps it's a lack of interest that means they're not engaging. And we're currently completing in-depth theoretical work actually showing that our arts engagement, pictured in the centre here, isn't just affected by these micro-level individual factors, but by broad factors at every possible level of society, and even things that are temporal, things that shift over time, like our social histories within countries. Therefore, if we really want to enhance arts engagement, we have to address these barriers at multiple levels, rather than somehow placing the emphasis on individuals to engage more. And we're going to be publishing a lot more on this work later in the year, so I'll be able to keep you informed as this develops, because of course it has key policy implications. So what can we do for now? One of the things that we recommended in the WHO report initially was to keep acknowledging this growing evidence base and recognise the added health value the arts can bring, and particularly the cross-sectoral nature of arts and health. We've published other briefings since with WHO, such as that intersectoral action. But we've recently gone further and developed an international policy map. This is hosted on the website, which I will share at the end, where we've looked at what are the policy documents on arts and health in every country that we could find around the world. And we've made this an interactive map where you can click on countries and actually link directly through to those policy reports. We've also published a piece in the Lancet Public Health, where we summarised what we'd learnt from these different policy reports and where we thought the direction could go for integrating the arts better in public health policy. And I think it's important that we really take this seriously, because when we're looking at what the Sustainable Development Goals are for countries all around the world, they're things that the arts can directly achieve. These are just 6 examples I pulled out, where it's very clear that the arts have a tangible role to play. And as I've been saying, a role that we should be taking just as seriously as other health promoting activities that are better recognised. I just want to finish by highlighting 2 reports that might be helpful for you to explore. One of them is an example report that we've been publishing on how to improve access to the arts, this one focusing on mental health. And as I said, we're going to be publishing a lot more on these different barriers to arts engagement, not just at individual, but at broader community and societal levels shortly. We've also published a report summarising the findings from our 100 studies so far using cohort studies. So this explains what we've identified about the impact of arts and cultural engagement on population health over very long time spans. All of this, including our policy map and more, can be found on our website, sbbresearch.org. And I look forward to hearing more about the debate and any questions on this. Thank you.
Thank you so much. Thank you so much, Daisy, for this really fascinating presentation and evidence and facts. I know that you have limited time and can't stay with us until the end, so I would like to open the floor for questions from the audience already now. And while people may think of a question, I have one myself. You've been mentioning one of the two reports you mentioned in the end, lowering the barriers for access, and you, during your presentation, you've also questioned that equal access problem. Maybe you have you can lift the tip of the report already for the audience here, local and city policymakers, local government and city policymakers. What can be done? Do you have a concrete recommendation that you can give us?
I think one of the things to recognise is whatever barrier we think we're trying to address, we have to follow the full journey of that barrier through. So let's say that we're trying to enhance people's access to the arts within their communities. Well, part of that is about the built environment, so making sure we actually have art spaces. Now that falls under a kind of town planning aspect, but another issue around that is around the infrastructure that supports that, so whether people have even got transport to get to those spaces. And then there are other issues around how those things are being funded, making sure that the activities are actually free or low cost that people can engage. And that falls under a totally different domain of local arts funding. It could even then be affected by how people are being referred through to this. We can't assume everyone will discover there's a new arts venue and take part. So there could also be things like social prescribing that are referring people through to that activity. But again, that's a different organisation completely. That's moving into healthcare. So if we're trying to address what even seems like a simple barrier, we have to acknowledge that everything is highly interconnected, and we really have to be addressing multiple barriers at once and realizing that this is not simple. It is a process that involves intense collaboration between very different sectoral partners if we genuinely want to make a difference to the individual levels of engagement that we see and the equity of that engagement.
Thanks very much. Is there a question from the audience? For Daisy, grab the opportunity. Yes, there are two. Microphone is coming.
Thank you. My name is Kat O'Driscoll. I'm a city councillor here in Dublin. Fascinated to see the evidence of what I would have believed laid out in front of us. I'm wondering about the intergenerational aspect of culture. Have you seen in your evidence that mixing generations has any added benefit? We've recently been looking at dementia, people living with dementia and the value of singing and music to them. But without, I guess, me as someone in my 30s, we're actually mixing generations. People in their 90s are mixing with people in their 60s, and it's a really fascinating piece. I'm wondering if that's come up in your research in any way. Thank you very much.
Cautious of the time, I propose we take the second question immediately, and you try to answer them in one go, Daisy.
Sure.
Second question is back there.
Thanks, that was fantastic, Daisy, really, really good. My name is Linda, I'm from Dublin City Council Culture Company. Sorry to add another Dublin question, but it's not specific to Dublin. I'm wondering, so it's throughout the report there's references to arts sometimes, and then other times arts and culture, and I think we understand what arts is, but I'm wondering what's counted when we're talking about cultural engagement. And I'm thinking of the community I live in. It would be reported that arts participation is low, but there's lots of other community activities that happen that maybe aren't being counted, like a bunch of people meeting to play bridge together or to knit together. And so we could look at ways to increase arts engagement there, but if we're not counting the other things that happen and what their impacts are, then maybe there's not a need. Maybe people aren't interested in some of those arts activities, but they're doing other things that have the same type of benefits. So I'm just wondering, yeah, what are we counting in really important reports like this when we're talking about cultural engagement? Thank you.
Thank you.
Both of these questions are really linked by the concept of ingredients. So you're asking about, for example, intergenerational work. Well, that's an ingredient, providing people from different generations. That's one of the social ingredients of the activity. For something like dementia, that's got a very clear relevance because there's so much work on the importance of intergenerational activities for supporting memory and supporting people socially as they experience dementia. So that feels an important ingredient there, where it might not do for certain other kinds of health outcomes or populations you might be working with. And ditto for that second question. That question is about ingredients. So knitting groups, of course, would count as arts. People who are engaging in other things like playing cards or bridge, technically it's not an art form, but the shared ingredients between doing a bridge activity versus doing, let's say, a book club would be probably about 95% the same, in which case you probably achieve many of the same ingredients you would need for lots of different health outcomes. But of course, there are some things that the arts can bring uniquely, such as the imagination and the aesthetic response and the multi-sensory stimuli that I mentioned, that for certain health outcomes might actually start to be quite important. But I think in general, if we're increasing the arts or art-like activities within communities, that's what we should be focusing on rather than worrying too much about individual ingredients for broad population health outcomes.
Mm-hmm. Thank you so much, Daisy, for being with us. And I know you are pressed with time, as are we. We let you go with a big applause and thank you for your contribution. Now we stay within Dublin and dive deeper into a practice example, I would say. I mean, we've heard about the Dublin City Council Cultural Company. We've seen the film. We've got questions, and also the last days we saw examples already. I'm very glad that now comes my proof. Isolde Dunn, the CEO, is with us. And without further ado, I'll give the word to you.
Fantastic, and thank you very much. I think there's a presentation, and I think I wanted to kind of give a little bit of an introduction to our work, but of course we have flavored the whole conference with an introduction to our work, so I won't go into too much of the broadness of it, but I wanted to really add that in every interactions that you've had across the conference, whether it's getting your notebook or getting your headset, you're being met by our staff and our team, and I think they really exemplify our work and our desire and passion for the work that we do in how they are and how they like engaging with people, and that's the work that we do. We've shown you some of the various interventions that we've done across the way. We've been around for many years. There are many more fantastic examples. So I just wanted to talk about the principle, first of all, about the company existing. It was established by the municipality to focus on cultural participation and cultural engagement. And it is a huge privilege to have a company and a group of people who are passionate to work and focus on that area. We do it in running buildings, in running museums, in running intelligent projects, in running consultations, placemaking, artistic projects. You know, we apply a principle to many different aspects of the city, and it is a delight and a huge passion for our team to be able to focus like that, but also a huge step for a municipality to give that area so specifically a resource and a focus and a legitimate kind of road to travel to put value on developing the opportunities for cultural participation, for cultural engagement, audience development in the area of culture. So sounds weird, but a huge kudos has to go to the municipality that has agreed to allow a focus in that area, and I really believe that to be true. I don't know if this works. Lars was going to ask me a question, and I asked him not to, because I really wanted to focus on this idea of everybody instead of the question that was on the sheet. But we did this project a few years ago. We worked with a community grouping, various ages, intergenerational, all sorts of activity over many, many months, kind of collecting stories, talking to people. People wanted to sing a song, write a poem, tell us about their lives. We spent a lot of time sitting around eating breakfast with them. There was a lot of food, cups of tea, all of the usual. And in the end, we worked with the orchestra, the National Symphony Orchestra of the country, to put their stories and their performances to kind of be the backing track to some of their stories. And it was a huge performance on the national stage with the National Symphony Orchestra. And one of the guys, he's in the picture there, called Ray, his summary as he came off stage was, everybody deserves an orchestra. And I think that's really been something that's stuck with me. There's a few other interactions with people across the years, but everybody does deserve an orchestra. And I think that is, it goes to cultural participation, but it also goes to health and well-being, that we all have a role to play with culture, and our lives has a role to play with everybody else's lives. So that was just something I really wanted to share, because everybody's life does deserve an orchestra. I suppose we note that, and a lot of what Daisy was saying, obviously, that people are thinking about, are they comfortable to be involved? Are they represented? Does anybody look like them wherever they go? Can they come along? Do they have permission? Is it suitable for their additional needs or their needs at all? Are we talking in plain language? Do they understand the invitation? Is it addressed to me? These are the things that people are thinking about, and there are other barriers, as we well know. And like Daisy said, they need to have individual things. We need to think about them. So we think about who has access. We think about who's being left behind. We think about all of the different routes to access, to being involved in culture, to the different types of culture. We don't use the word arts, actually, because we're so aware that it's contentious in terms of what people are already doing, and we don't want to classify what they're doing. And then the big thing is where they're doing it, and that all of the various places where culture happens, is where culture is. It's not needing to be brought to a special place that we determine to be the place of culture. So that's what we think about when we approach a building, when we approach a culture-making project in any way, or an intelligence project. We were talking a little bit about impacts, and the real ambition is to make an impact, that there are more ways for people to get involved and get into culture. There are more opportunities for people to do culture the way they want to do it, and be involved in it the way that they want to be, and try out new things, and be comfortable or not. But most importantly, that it builds their own capacity within their own lives around how they think about themselves and about culture, weighs into kind of habit-forming behaviour, that they are able to include it in their lives in whichever way that they want to. And we see those impacts in lots of different ways, and try to gather them. And there's studies and research that we do. We'd love to feed it into Daisy's work, but the idea that those are the impacts that we're making, and there's many more to make. As a company, we have a mission statement, and it's about connecting people to, culture, and through conversations and with each other in communities. But we're really clear that it makes people more connected to themselves, to their community. It makes them feel safer and stronger and be healthier. And these are big statements that we make within our strategy, and we believe them as a team all the time. That's it.
Great. Thanks so much. Lots to follow up on, but I hope we'll have time for that after all the presentations. I'll move on immediately to Stefan Tăișanu from the Cluj Cultural Center in Romania and European network Culture Next. Cluj Cultural Center was a key partner in the Culture for Health project, but also you personally, as a cultural entrepreneur, are interested in urban and community development, have a long track record. You don't only, as a Cluj Cultural Center, work in the Culture for Health project, but in many other projects that cross boundaries to other disciplines with a big focus on well-being. I'm glad you are here, and off you go.
Thank you for inviting me, and thank you, Isolt and Tracy and the wonderful team for the great job you're doing here. I love this city, and I loved the Andy Warhol exhibition last night. Go see it if you have time. And also what you are doing with the Dublin, with the company, with DCCC. See? It's really inspiring to me and hopefully to all of us. As already stated, cultural participation is the absolute key to bring an impact through culture in well-being and health. Our journey in Cluj with culture for well-being and health started years ago when a colleague and friend of mine had to face some personal troubles with one of their beloved dying, and then she called me and said, you know, I think if we want to make a difference with culture, we should engage with this, with people that are suffering emotionally or mentally or physically, and this is how it started for us. And then a few years later, when I'm in Helsinki with Daisy and with Niels from the World Health Organization, listening to a speech similar to what Daisy has just given us. They were launching this report, this WHO report. And this is when I understood that we are now in a moment where this is not only a myth or a legend that culture can contribute to it, but now we have like the technical ground, the data that prove that we have the capacity and the potential to contribute to culture and health. So this is what we're trying to do with the Cluj Culture Center, and I'm going to share just a few examples today. But also, before starting, I just want to point out that during our recent work with the Culture Next Cities Network, that is a city with 34 European cities, former or current candidates for the European Capital of Culture title, awarded or not. We ran this analysis. We put our bid books into an AI machine. It grabbed all the data, and we tried to look at what is the promise of the European Capital of Culture bids, what SDGs are they actually supporting. And the top two SDGs were, of course, sustainable communities and, of course, surprisingly or not, health. So this is obviously a big topic for all of us. We're going to discuss more about it tomorrow as well. Cornelia, our colleague from Culture Action Europe, is running a workshop with the ones of you interested in getting to know more about what we can do at the local level to tackle this topic. Now, in Cluj is a less than 500,000 inhabitant city in Romania. We are working on a few pilot projects that try to tackle very concrete health and well-being issues. We started with a strong partnership with the World Health Organization and some other important players in Europe. And I will mention a few examples. We are running this series of art workshops called Music and Motherhood. We engage with young mother with postpartum depression, and we take them through a journey of music with choirs especially. And we of course, we are measuring their postpartum depression level at the beginning, at the end, their well-being indexes as well. And the results are really, really good. You can search for Cluj Culture Center, Music and Motherhood, and you're going to find out, you're going to be able to see some nice movies and to find some really interesting data. Another project that we're doing, another pilot project, tackles work burnout, and we're doing it through a series of interventions with performing arts, visual arts, We started with only people with severe burnout, when we understood, after repeating the experience, that around 70 of them end this 7 to 10 weeks journey with medium burnout instead of severe burnout, and the others ended with low burnout. Right now, at the local level, we're trying to push this idea that culture for health in companies, in employers, so on the labor market, can really make a difference by increasing the well-being level of the employees, and therefore increasing their work satisfaction and work productivity. And we just had a Culture for Wellbeing forum dedicated to companies. It was a really amazing experience. It was the first time when we as culture people, as scientists working in the field of culture and health, got this sort of exposure to real life, so to say, to companies that are looking at figures when they are making decisions, and the impact was really good. Right now, we're trying to promote this idea of a chief culture for health officer in the HR departments of the companies. Another action that we're doing with the Cluj Culture Center, and I'm going to close with this one, is engaging at the European level and engaging at the international level. And I think that's crucial, because we have solid proof, solid data in culture for health, but we don't have enough action. We don't have enough examples. So we are still far from being able to build a critical mass on the topic, and that's why I was very happy to be able to get involved with Culture Action Europe and our great consortium for the Culture for Health initiative that you mentioned. I think the work that we managed to do together with the WHO, with all our partners, opens new grounds for this field in Europe. Please have a look at cultureforhealth.eu. Find out more about the pilot projects we did, and especially the projects we mapped out around the continent, and the policy proposal that we submitted for the European Commission to look at. They read it in the Commissioner for Culture, Innovation, Health, Education and Youth read it in the European Parliament 1 year ago, and I think we're making solid progress. Thank you.
Thank you so much, Stefan, also for highlighting Culture for Health again, and I'll get back to that as well later, because we have to keep pushing it. I'm now really, really happy to have Jill Sonke with us, Director of the Center for Arts and Medicine at the University of Florida. With more than 25 years of experience and leadership in arts and health, Jill is active in research, teaching, and international cultural exchange. Her current research focuses on the arts in public health, the arts in health communication, and evidence synthesis in arts and health. And we were very privileged to have you in an online session for our annual conference earlier this year. So I'm all the more happy to meet you in person and have you in a conversation now. The floor is yours, Jill. Thanks for being here.
Thank you, Lars. It's wonderful to be here. It's really wonderful to be here. I live on the island of Manhattan in New York, and I did my PhD on this island. So it's really, really wonderful to be here with you all today. So as well as serving in the Center for Arts and Medicine at the University of Florida, I serve as Director of National Research and Impact for a national initiative in the United States called One Nation, One Project. And this initiative builds on the work that you heard Daisy talk about. Daisy and I also co-direct the EpiArts Lab, which is a National Endowment for the Arts Research Lab in the United States that extends the statistical work that you just heard about to the US. So in the EpiArts Lab and in One Nation, One Project, we understand, as Daisy said, that arts participation, arts and cultural participation is a health behavior. And we also understand that access to arts and culture is a social driver of health. And so in One Nation, One Project, we're seeking to leverage the power of arts and culture at the national level to drive social cohesion, well-being, and health in communities across the nation. This is a post-pandemic initiative that recognizes the critical importance of artists and culture bearers and arts organizations in being at the table around dialogues centered around community development and recovery when things go wrong, like the pandemic in our communities. So One Nation, One Project seeks to drive cross-sectoral collaboration between municipalities and the public health and arts and culture sectors. So in One Nation, One Project, 18 American communities, ranging from small villages with populations of 850 people to big cities like Oakland, California, Chicago, and the Bronx in New York. And each of those communities is working over a 2-year period of time to develop initiatives that center arts and culture to build health and to advance public health. And they're doing all sorts of innovative things. In the city of Chicago, they've hired and they're training artists to work as community health workers. So they'll take the arts with them in their community health worker engagement. There are communities that are implementing social prescribing, which you also heard Daisy mention. There's one community where there's just simply no access to clean water, and so they're using storytelling to raise awareness of the issue of clean water and to drive huge change around clean water. There are communities addressing food scarcity. And at the end of this 2-year period, on July 27, 2024, all 18 communities will culminate their work in big spectacles like festivals or performances, and we as a national entity will lift up those local narratives in one national narrative. We've engaged a major PR firm, and we've just launched a campaign, and I love the overlap here in the language, a national communications campaign called Arts for Everybody. So in this initiative, we're really seeking as our primary goals to normalize cross-sector collaboration and to normalize the position of arts and culture, individuals and representatives at the table with municipalities in building communities and solving problems. And we're also seeking to drive policy in that way and to advance understanding among the general public that arts and culture are available local resources for health and well-being and social cohesion. In our research undertaking, we're testing a theory of change that was developed previously in the United States that links arts and cultural participation with social cohesion and equitable community well-being. So we're looking at a community level, and we're seeking to test that theory of change through a very complex mixed methods study. We've developed a really exciting application, online application for surveying that is artified or aestheticized, that sort of gamifies the process of taking a survey. And so far we've collected baseline data. In January, we'll start our midpoint data collection, and at the end of 2024, we'll do our last data collection. But already at the baseline level, we're seeing that people who participate more in arts and culture already have an understanding that that participation is linked to their health and well-being and linked to social cohesion in their communities. We're also recognizing some of the barriers, of course, that Daisy talked about to access to arts and cultural participation, and so we seek to address those barriers in this work as well. So I'll pause there. Thank you, Lars.
Thanks so much, Jill. That's very exciting. So we move on to Montpellier, and I welcome Eric Pinceau, Vice President in charge of culture at Montpellier Méditerranée Métropole, and Thomas Coroleur from the International Relations Department, and if I understand you correctly, in charge of the candidacy of Montpellier for European Capital of Culture 2028. And you are singing a duet for us somehow. Whoever wants to start, go.
Yes, I'll start. Thank you very much for inviting Montpellier and us two to this conference. It's an honor for us to be here. As far as I'm concerned, it's a personal pleasure to be here as well. First time in Ireland, as I mentioned. May I suggest, first of all, sending Daisy's presentation to everyone. We're all convinced here of the importance of culture in our lives, but I think the figures that she showed in her study are very important. They should be spread around. So if I can make a suggestion, would be to send this to everyone, so to increase the audience of the importance of this matter. Montpellier has always been very sensitive. I'm also the mayor of a small town near Montpellier, so I'm not a specialist of the topic we're talking today, but I have a field approach, so I can relate to what we do and what we try to do on our territory. First of all, Montpellier, south of France, for those of you who don't know where we are, is very sensitive to health, particularly because we have a unique ecosystem. You know that we have the oldest school of medicine in the world, over 800 years old now, and also a network of leading universities, hospitals, and startups shaping the health of the future. So in the wake of the pandemic, we took some initiatives with my colleagues and built some challenges, particularly in relation to health, mental health, sorry, I wanted to say. And our bid to become, hopefully successfully, I hope, the next capital of culture in 2028, but Thomas will be giving you more details on that, is an opportunity for us to accelerate the initiatives we've been linking culture and health in this territory. With a view to obtaining the World Health Organization age-friendly city, Montpellier has also developed an aging well plan for a city adapted to senior citizens in connection to our 2028 project in 3 areas of culture and health, which have been identified. First of all, facilitating access to culture for senior citizens, increasing the number of initiatives to reach out to isolated senior citizens, particularly in those precarious situations with mobility problems, promoting cultural and medical social actors to make culture more accessible to those what we call hindered audiences. Montpellier, through its 2028 plan, wants to play a greater role in these issues at a national but also European level. We've been talking to our friends in Oulu in Finland about their smart hospital, and of course we have a particularly important project that Thomas will be explaining in a minute. I hope the film works. It's better with the film. It's called Art on Prescription. So I think the title itself is interesting, and Thomas will be giving you more details. But if this project, which is a pilot project for Montpellier, proves successful, we will certainly go ahead with it. Thank you very much.
Thank you, Eric. So you said it all, actually. Yeah, so I'm Thomas. I'm in charge of international relations for Montpellier 2028. Actually, we just handed over our bid book like a few weeks ago, so we're very interested, Stéphane, with your comment on AI and bid book, maybe something to consider in the future. But yeah, I mean, basically, we see that it's gaining momentum in Montpellier, this health and culture project. And basically, one of these projects that we support at Montpellier 2028 is called Art and Prescription, and it's a unique project developed by the MOCO, which is the Contemporary Art Museum of Montpellier, and the CHU, which is the University Hospital of Montpellier. And hand in hand, they developed a project called Art and Prescription since 2022, and after the wake of the pandemic also. So we have a short film showing this project. Hopefully we can have it, yeah. So it's in French subtitles, so maybe you want to put your headsets, everyone. Yeah.
Art leads to feeling all sorts of emotions when you visit an exhibition or when you practice an activity in the art level. We do feel well-being. So this is why we have our project called Art Prescription. We're working with the psychiatry department of the University Hospital of Montpellier with an unusual program. We ask participants to co-share times with artists for creating art. Over the last 20 years, scientific research shows that art is a guarantee of good mental health, and very good scientific studies shows that if you have contact with art and culture, you have a longer life, you can prevent depression and improve well-being. We send patients, mainly patients who suffer from depression or for isolation, in some cases who have suicidal thoughts. We take them to workshops with professional artists. Every session lasts about 1 month. One first session is to enable participants to meet the artist, then they visit the exhibition, and after that we have 4 or 5 different workshops. In 2022, we invited 3 artists who had very different ideas and different approaches. So the first artist in this program asked for painting times, and then there was an exhibition, and after that it was follow the hair, and follow the hair was to follow this kind of rabbit around different types of sculpture. The originality of this program is that we have the association of art students and psychiatry patients. We have different sessions, and artistically and scientifically we can report what has happened during the sessions.
Short example of the project Art and Prescription, and just 30 more seconds. I think you were talking about proofs, I think, and evaluation. I think that's quite important. So basically the project is subject to a follow-up observational study conducted by the teams of the hospital also and the teams of the MOCO. And just to assess the impact of the artistic intervention on the mental well-being of the patients, the quality of life, and changes in anxiety and depression. So I think this is interesting. If it's successful, hopefully we'll be able to continue the project and maybe replicate it in some other parts in France. And yeah, and Montpellier 2028 is really fully supporting this project.
Thank you both. I'm now dashing on to keep the time frame somehow, because I got a threat that the mics will be turned off sharp at past. So I'm now really happy to introduce Niels Fietje, Research Officer at the World Health Organization Europe Unit. He's based in Copenhagen. He has 15 years of experience in academic research, particularly within the medical humanities, and an extensive track record of innovation in the health and well-being arena. At WHO Europe, he is leading an innovative public health project on the cultural context of health. And Niels, to add a personal note, I'm really, really disappointed that you're not here, because I really got used to us being together on a panel. But online is better than nothing. Thanks for being here.
Lars, you and me both. I am also deeply disappointed that I couldn't make it, and very grateful for the opportunity to come to you virtually and online. But hopefully in the future I'll be able to be present as well, physically present, and not just a virtual shadow. So I want to talk about culture in 2 ways: as a context and then as an active ingredient, because I think increasingly it's fair to say culture is being recognized as a vitally important context in which health operates. At WHO Europe's Behavioral and Cultural Insights Unit, we use behavioral science-based approaches to better understand the barriers and drivers that contribute to health challenges. And it's difficult to find a public health challenge which does not involve a behavioral component. Cancer, hypertension, epidemics, antimicrobial resistance, the health impact of climate change, and rising mental health challenges, none of these challenges can be addressed without exploring or understanding or addressing and supporting behavior. But I think at the same time, all of these challenges are also deeply affected by cultural contexts. So if we take obesity, for example, even though a biomedical approach may focus on nutrition, we have to recognize that the vast majority of what constitutes the food pathway is cultural in nature, from what we sow to how we harvest, from what we cook to how we eat. It's only after we swallow that food turns into a biochemical reaction. Everything before is sociocultural and behavioral. But the importance of culture to health goes beyond its influence as a contextual factor, and that's really been the main point of this panel. We're living in increasingly complex times, technologically, environmentally, geopolitically. Even our health challenges are becoming more and more complex. Today, non-communicable diseases are the leading cause of death and disability in the WHO European region. And before the COVID-19 pandemic, it was estimated that the number of people with mental health conditions stood at over 125 million, equivalent to 13% of the population. Now, after the pandemic, it's safe to assume that this wave is building into a tsunami. To help address many of these changing health challenges, a single drug, a one-off surgical intervention is often no longer sufficient. We need to think creatively, multi-sectorally to find solutions and to share the burden of prevention, promotion, treatment, and management. Now, of course, I have to say that there are many ways that we need to do this, but one of those ways is by developing culture and art for health initiatives. As we've heard in today's panel, research is increasingly showing how cultural activities and arts interventions in particular can have a clinically measurable impact on our health and well-being. The 2019 scoping review, which Daisy spoke about, signaled a start of WHO's journey into the arts and health space. Since then, we've championed the development of partnerships between the health, social care, and arts sector on the ground and in policy briefs. We have promoted the use of arts and health as a form of mental health and psychosocial support for forcibly displaced people in a rapid evidence review. And we've begun a collaboration with the Jameel Arts and Health Lab to build a world-leading platform for engaged research and evidence-based practices in the area of arts and health. So I know we're beginning to run out of time, and I certainly wouldn't want to be cut off in medias res. So I'm going to limit myself to talk about two examples where WHO's work on culture and arts and health has been going. And both of those examples have been work that we're doing together with the Jameel Arts and Health Lab. And I think they will have an important impact on the field. First, in terms of improving and promoting the evidence base, we're leading on a newly announced Lancet Global series on the health benefits of the arts. The Lancet, for those of you who don't know, is the world's highest impact academic journal. And the series will include 4 papers and will focus on non-communicable diseases. It's also going to raise awareness about the existing evidence base and offer recommendations to improve global policy guidance on topics like scaling up promising interventions through social prescribing and intersectoral collaboration between the arts, health, education, and social care sectors. Ultimately, I hope it will be able to build on the work that Daisy's been talking about, together with many other academics, to forcefully argue that engaging in the arts is, like physical activity, a form of health behavior. Second, I want to leave you with a practical example of an evidence-based arts and health intervention which we've been implementing in 5 cities across 3 countries. Now, Stefan has already talked briefly about this because the Cluj Culture Center was a treasured partner in this project. But I wanted to say a couple of words more. As Stefan said, the intervention supports mothers who are experiencing postpartum depression using specifically designed singing groups to support them. The intervention is low cost, it's low risk, and it's very effective. A randomized controlled trial conducted in the United Kingdom showed that the intervention reduced postpartum depression symptoms by 38% and led to faster recovery in mothers with moderate to severe symptoms when compared to usual care. As a result of the project that we've been doing, we have now developed a protocol for localizing this intervention in different cultural contexts. and will soon be publishing an implementation thinking tool based on our experience. A number of municipalities and regions and countries have been in touch with us, wanting to learn more about the intervention and how to implement it. So we've decided to create a community of practice through which to share our experience with interested parties. And I wanted to encourage you all to let me know if you'd like to join. Unfortunately, I couldn't be in Dublin in person to continue the conversation after the panel, but there are a number of people in the conference and on stage, including Jill, Stefan, and Lars, who can tell you more about the project and who can connect us. So do, I implore you, come and join us on this arts and health journey. You're welcome.
Thank you so much, Niels, for this contribution. We've got 5 minutes for questions, so use them wisely. It's up to you to ask questions to the panel on stage, or Niels online, who will stay with us for a few more minutes. Otherwise, I will use the time to ask one of my many questions that are on my mind. And I'd like to explore for 1 second maybe the perspective of the artist in the projects that you've been describing. And to put it a little bit black and white, I guess we are not after an artist rambling around in an elderly home for a nice project to put on their CVs, but rather to make the difference between broadening access and real participation, where you give away power to communities, rather a longitudinal approach that requires a certain ethical mindset. How can we prepare our artists for that? Are they prepared for that? How can the interplay between the health sector and the cultural sector, maybe when it comes to educational research, be developed in the future? Or where's the challenge there?
Well, are you looking at me? And
I'm looking at you. I'm looking at all of you. But you go first.
I like to have a rant about this on a regular occasions. My concern in this area is that artists spend a lot of their time seeking funding, and once they get funding, they are left alone. And it's one of the key things that we do in the Culture Company is an infrastructure of support. Because artists shouldn't be left into corridors in hospitals roaming. You know, they're encountering things they don't know about. They're encountering situations that are challenging to all humans, and artists are humans too. So I think what we need is that the grown-ups in the room, the people who are institutions, the people who are municipalities, the people who have money, need to understand and work together to create the environment for the artist to be able to work in this field, or to know more about the circumstances that they're involved in communities. And I really lay the blame with a lot of the funding applications, the funding forms, all of that infrastructure that isn't wise to the reality of life out and about. Yeah.
Thank you.
Yeah, totally in support of what you said, but I think there are 2 scenarios to explore. First is when you're trying to do to raise cultural participation, to engage more people, to give access to people to culture. That is a factor that increases well-being in itself, and for this we need like mechanisms and frameworks to support the artists to just be able to do their job. On the other hand, when you are going for more precise intervention in mental health, emotional health, or even physical health, this is, I think, a totally different story. For instance, in our experience with the World Health Organization, when we replicated music and motherhood in Cluj, we had such a long, intensive journey to actually prepare that intervention, to work with the artists, with the scientists, with medical doctors, and with postpartum depression, with mother with postpartum depression, to actually prepare that curricula. And then we went to the ethical committee of the WHO and of our local university to make sure that the way the artists are prepared and are working is aligned with our interests. So I think there are two different scenarios that we need to look at.
Thanks very much. I know there's more to say, but I'm aware of the threat of the time frame. So I'm just to wrap up. I'm so glad that we had these perspectives of evidence. I mean, from Daisy, from Niels, but also the mix of research and practice experience from the US, the examples from Montpellier. But especially to hear more about your work in Dublin that has been interwoven throughout the conference so far. And I invite you all to approach the speakers in the lunch break, speak with them, pick their brains, get the conversation going in a more social setting. For me, I take this as an encouragement to reinforce our efforts at Culture Action Europe, together with all the partners that are here on the stage and in the audience, to work on the theme of culture, health and well-being. In the EU, we have a political momentum. Just before the summer, the European Commission has launched their comprehensive approach on mental health, where culture is mentioned 7 times. I think that's a little bit due to the efforts of many people on the panel here, that there is an awareness and we have to use that momentum wisely. And I'm really happy to engage with more of you to hear how in other parts of the world that political momentum could be used. I would like to reiterate the possibility to come to the workshop of my wonderful colleague Cornelia Kisch tomorrow morning, where we can discuss next steps forward. I know that Cornelia likes to talk, and I fully support that, about the culture and health movement that is unfolding. And we'll engage in a little roadshow next year that will start with a visit to the city of Tilburg in the Netherlands, where we will look at how city cultural policies can be better designed to amplify the correlation between culture, health, and well-being. And if any of you is interested to also be a pit stop on that roadshow, please come to the workshop tomorrow morning or just speak to my colleague Cornelia or to me. I want to thank UCLG and the Dublin City Council for this fantastic opportunity to be here, and for all of you for listening so carefully, and I'm glad to further the conversation later today and tomorrow morning. Thanks very much, especially to the panelists.
I was actually coming to say that this conversation isn't finished. I mean, it might be finished at this moment, but there is an opportunity to continue this discussion tomorrow morning in Richmond Barracks, and there will be a bus leaving from here at 9 a.m. for anybody who wants to join that workshop, which will start at 10:30. But also we can help you with instructions of how to get physically from here to Richmond Barracks if you don't want to go on the bus. So there is an opportunity. This discussion hasn't ended now. Also, I'd just like to say Jordi Pascal is also included in the threat, because he gave me the impossible task of trying to get all of you to speak on time and to get outside for a photograph. It is unpleasant outside, I think, is an understatement. So if you have a coat, please put it on you. But we're going to go and take the photograph in the steps, which are between here and the square and down onto the street. So you will be covered, but it is cold. And we're going to try and do that as quickly as possible. So now I'm going to have to go move them out of the Goldsmith. But thank you very much. And we'll do the photograph and then there'll be lunch. Thank you.